I always say to people, how much water do you drink? And these are some of the answers. I don't like water. If I drink water, my feet swell. If I drink water, I'm going to the bathroom all day. Those last two answers tell me that the water's not getting inside the cell.
Research has shown that seniors who followed these 10 simple methods reduced swelling in their feet and ankles by as much as 70% in only 2 weeks. And the best part, some people begin noticing relief just hours after trying these techniques. If you deal with swelling in your feet, ankles, or legs, then you already know how uncomfortable it feels. Your shoes become tight, your legs feel heavy, and even basic activities like walking can become a struggle. But here's something many people overlook. Swelling is not only uncomfortable, it can also become a serious health concern. Today I'll be sharing 10 effective ways to quickly reduce swelling in your feet, ankles, and legs. These are safe, practical methods created specifically for adults over 60. Before we get started, leave a comment below. Do your feet or ankles swell? And what time during the day does it get the worst? I read every comment, and hearing your experiences helps me make more helpful content for you. Now let's talk about why swelling is more serious than many people think. Swelling can lower oxygen delivery to your tissues, cause fatigue, reduce mobility, limit nutrients from reaching your cells, and lead to skin problems such as scaling and crusting. When fluid builds up in the tissues, proteins can collect in the skin and create a cycle that becomes difficult to stop. There are several reasons why swelling and poor circulation happen. Some people have vascular disease, which means blood flow to the feet becomes limited. Others may have venous disease, where blood collects and backs up instead of flowing properly. When this happens, the feet swell, circulation slows down, and larger substances like proteins become trapped in the tissues. Those proteins attract more water, which leads to even more swelling. In some cases, finding the root cause is important, and that absolutely matters. But today, we're focusing on practical methods you can start using right away to reduce swelling and discomfort. So here are the 10 best ways to reduce swelling in your feet and ankles. Number 1, elevate your legs to help circulation. If your legs are swollen after standing or walking for long periods, raising your legs for just a few minutes can help a lot. There's even a gravity-based test where doctors can see how quickly blood drains from the legs in about 45 seconds. But even without testing, the simple act of elevating your legs can greatly improve circulation. This is one of the easiest and most helpful recommendations. If possible, once or twice every hour, raise your legs for 1 to 2 minutes. Doing this can reduce swelling. It also lowers the strain on your heart and helps conditions like edema and varicose veins. Here's the proper way to do it. Lie down on a couch or bed. Place 2 or 3 pillows under your legs so your feet sit higher than your heart. Remain there for 15 to 30 minutes. Try doing this 2 or 3 times daily, especially in the evening after spending time on your feet. If lying down isn't possible, you can sit in a recliner with your legs raised. You can also sit in a regular chair and rest your feet on another chair or an ottoman. The important thing is keeping your feet above your hips. Number 2, exercise to improve blood flow. Regular movement improves circulation in your feet and legs. After your heart, your muscles are the next strongest pump for moving blood through your veins. Whenever muscles contract, they squeeze the veins while small valves stop blood from flowing backward. This helps push blood back toward the heart and lowers swelling. That's why walking is so helpful. Walking, light jogging, and cycling all work very well. But for most seniors, walking is usually the best and simplest choice. Here's an old historical example that shows how important movement really is. In the Old West, one form of execution involved tying a person to a tree. Without movement or physical activity, fluid would build up in the body and place too much pressure on the lungs and heart. Within days, the person could die because they were unable to move. That shows how necessary movement is for healthy circulation. Exercise also activates a process called angiogenesis, which means your body creates new blood vessels to improve blood flow. Research shows that strength training and cardiovascular exercise are some of the best things you can do for overall health and longer life. For seniors, I suggest starting with 10 to 15 minutes of walking each day. Slowly work your way up to 30 minutes a day, 5 days a week. If mobility is difficult, chair exercises can still help. You can move your legs, march in place while sitting, or do seated leg raises. Swimming and water aerobics are also excellent choices because water pressure naturally helps lower swelling during exercise. The water also reduces stress on your joints because of its buoyancy. Number 3, compression stockings. I'm a big fan of compression stockings, but they need to be used the right way. There's a proper approach and an improper one. If you want insurance to pay for compression stockings, be aware that it can be difficult. Most insurance companies usually won't approve coverage unless you have certain medical conditions that are officially diagnosed. If you plan to buy them yourself, they're easy to find over the counter now, and I'll explain what you should choose. Start with a compression level of 10 to 20 millimeters of mercury. That amount alone can create a noticeable improvement. Compression stockings apply pressure to your legs, which helps stop blood from collecting in the lower legs or flowing backward. Instead, they help move blood back up toward the heart. Begin with lighter pressure. Keep them comfortable. You don't want them to feel stiff or painful. That pressure helps blood return to the heart more efficiently. This can reduce swelling and help with blood clots and varicose veins. Here's what older adults should know. Compression stockings are sold in several pressure ranges: 8 to 15 millimeters of mercury, light compression for mild swelling, 15 to 20 millimeters of mercury, medium compression for everyday use if you spend long hours standing or sitting, 20 to 30 millimeters of mercury, firmer compression for larger amounts of swelling or varicose veins, 30 to 40 millimeters of mercury, very firm compression that usually requires a prescription. For most seniors dealing with everyday swelling, 15 to 20 millimeters of mercury is a good starting point. It gives helpful support without becoming too hard to put on. And yes, putting them on can be difficult at first. Here's a helpful method. Turn the stocking inside out until you reach the heel area. Place your foot into the foot section first, then slowly roll the stocking upward along your leg. If you need extra grip, rubber gloves can help. Put them on early in the morning before swelling begins. Wear them during the day while you're active. Remove them at night when you're resting in bed. Also remember to replace them every 3 to 6 months because the compression weakens over time. Number 4, massage for quick circulation support. Massaging the feet and legs helps stimulate blood flow. I've had patients experience major improvement from massage. There are also easier options now. Foot massages and leg massages are much more affordable than they used to be. Personally, when I'm sitting at my desk, I use a foot massager, and it helps a lot. Sometimes it even reduces sore muscles. I use it every day for around 10 to 15 minutes, and I notice a strong effect in my calf muscles afterward. I simply feel much better. I strongly recommend trying them, especially since prices are now fairly reasonable. The same applies to leg massages. There are many very good choices available that can really help. Massage reduces muscle tightness and widens blood vessels. It also helps the body relax and lowers stress. If you don't want to purchase a massager, self-massage works too. Use your hands and gently stroke upward from the ankles toward the knees. Apply pressure that feels gentle but steady. Do this for about 5 to 10 minutes on each leg. You can use lotion or oil to help your hands glide more easily, or you can ask a family member to help with a gentle massage. Even soft pressure and slow stroking movements can help move fluid away from the feet and ankles. Number 5, warm baths for better circulation. Warm baths are known to widen blood vessels and improve circulation. This helps oxygen and nutrients move through the body more easily. Personally, I enjoy Epsom salt baths. Epsom salt contains magnesium, and magnesium supports heart health and circulation. You can also add essential oils if you want additional benefits. Here's the correct way to do it. Fill your bathtub with warm water, not hot water. Add 1 or 2 cups of Epsom salt. Soak for about 15 to 20 minutes. Try doing this 2 or 3 times each week. The water should feel comfortable, roughly 92 to 100 degrees Fahrenheit. Water that's too hot can actually increase swelling and place extra strain on the heart. If taking a full bath isn't possible, foot soaks can still help. Place warm water and Epsom salt into a basin and soak your feet and ankles for around 15 minutes. Number 6, ankle rotations to stop blood from pooling. Simple foot movements can help a lot. Moving your feet up and down or rotating your ankles helps circulation. If you're sitting on a plane, working at a desk, or even pressing your feet against the floor, those movements activate your muscles and help direct blood back to the heart. Very basic exercises are recommended. Moving your feet up and down and pressing against the floor can make a real difference. When I'm sitting on an airplane, I even imagine doing squats in my seat. 5, 6, 7, 8, 9, 10. It greatly improves circulation, even when you aren't moving around much. This type of movement is called isometric exercise. Simple exercises like these help reduce swelling and discomfort. Your calf muscles act like powerful pumps for circulation. Here are a few exercises you can start doing right away. Point your toes downward, then pull them upward toward your shin. Repeat this 10 times. Rotate your ankles in circles 10 times clockwise and 10 times counterclockwise. While seated, keep your toes on the floor and raise your heels upward. Hold for 3 seconds, lower them, and repeat 10 times. Do these exercises every hour if you sit for long periods. They take less than 2 minutes but can greatly improve circulation. Number 7, stretching for fast circulation support. Like strength exercises, stretching helps lengthen and loosen muscles. Flexing your feet upward and downward or reaching toward your toes, even while sitting in a tight space, can help a lot. This reduces blood pooling in the legs and feet. It's especially helpful after sitting for a long time. Very effective. Even if you remain seated, you don't need to stand up to stretch. You can still stretch your legs and feet where you are. When I work, I use a standing desk and keep a stretching mat nearby. I regularly stretch my legs while standing at my desk. For seniors, these are safe stretches to try. Sit in a chair and extend one leg straight forward. Flex your foot and hold that position for 10 seconds. Repeat 5 times for each leg. Sit down and place one ankle over the opposite knee. Gently press down on the raised knee to stretch the hip and improve circulation. Hold for 15 seconds on each side. You can also stand while holding onto a chair for balance. Move one foot behind you and press the heel toward the floor to stretch the calf muscle. Hold for 20 seconds on each leg. Number 8, hydration. Hydration can be a little complicated because people with kidney disease, for example, may hold too much water in the body, which causes extra fluid buildup. But if your kidneys are functioning normally, staying hydrated helps blood move more smoothly through the body by maintaining healthy blood thickness. When you're dehydrated, blood flow becomes slower and more difficult. Your blood gets thicker and less fluid. It becomes more concentrated, almost like syrup or jam. Try to drink at least 8 glasses of water each day. This helps support body function, circulation, and energy levels. Here's some practical advice for older adults. Try to drink 6 to 8 glasses, or about 48 to 64 ounces of water throughout the day. Don't drink large amounts all at once. It's also a good idea to stop drinking water about 2 to 3 hours before bedtime so you don't have to wake up often during the night to use the bathroom. If you have kidney disease or heart failure, follow your doctor's advice about how much fluid you should drink. Some people may need to limit fluids. A few signs of good hydration include pale yellow urine, not feeling thirsty often, and skin that quickly returns to normal after being gently pinched. Number 9, avoid sitting with crossed legs for better circulation. Crossing your legs for a short period is usually okay. It can even help stretch parts of your body like the hips, glutes, and hamstrings. But staying in that position for too long may reduce circulation. It places pressure on certain veins, which can create circulation problems over time. In rare situations, nearby nerves can also become compressed. Try sitting with both feet resting flat on the floor and switch positions often. A physical therapist I know recommends changing positions every 15 minutes, legs apart, legs together, legs crossed, legs stretched out, then continue rotating through those positions every 15 to 30 minutes. This can even help while watching television. Moving regularly stretches muscles, while sitting still for long periods allows blood to collect in the legs. Number 10, reduce sodium intake for better circulation. I recently talked about kidney disease in another video, and people with kidney problems should usually limit salt intake to around 2.3 grams or 2,300 milligrams per day. When you check food labels, you'll notice many packaged foods contain large amounts of salt because it helps preserve them for longer shelf life. Reducing sodium can make a major difference, especially for seniors and people with diabetes. It can lower blood pressure and reduce fluid buildup in the body. I also discuss foods and supplements that may help lower blood pressure and support kidney health in other videos. For most older adults, here's a simple guideline. Keep sodium between 1,500 and 2,300 milligrams daily. Avoid adding extra salt at the table. Check nutrition labels carefully. Anything above 400 milligrams of sodium per serving is considered high. Try to stay away from processed foods, canned soups, deli meats, frozen meals, and salty snacks. Use herbs and spices for flavor instead of salt. Too much sodium causes the body to hold extra water, which directly increases swelling in the feet and ankles. And now here's the important secret I mentioned earlier. You need to combine all of these methods together. Most people I examine have mechanical imbalances. What that means is when I examine the foot, ankle, and muscles with ultrasound, I often find swelling, soreness, and inflammation. Certain muscles and joints become irritated and painful. That inflammation contributes to swelling in the feet, ankles, and legs. If the mechanical problems aren't corrected, the swelling usually continues no matter what else you try. So if these methods aren't helping enough, you may need a biomechanical evaluation. That means checking the way you walk, how your feet move, whether you have flat feet or high arches, and whether your shoes properly support your body. Start with better footwear. Supportive shoes and proper insoles can make a noticeable difference very quickly. Joint discomfort often decreases right away, and over the next several days or weeks, swelling and soreness improve. That helps you stay more active, and as you walk more, circulation improves, muscles become stronger, and new blood vessels develop. After 1 week, 2 weeks, and 3 weeks, recovery begins to build. You grow stronger, and your cardiovascular system starts functioning more efficiently. At first, compression stockings can help move fluid upward through the legs. They often make a big difference. Later, as strength and flexibility improve, many people rely on them less because the body begins functioning more naturally again. That means you're making progress. This is the biggest secret, and it helps more than 90% of my patients. At the same time, serious conditions involving the kidneys, liver, heart, or blood pressure must still be treated properly. Those conditions require medical care in addition to lifestyle changes. Here's when you should contact a doctor. Get medical help immediately if swelling suddenly appears in only one leg and becomes severe. That may be a blood clot. Seek urgent care if you have chest pain or trouble breathing along with leg swelling. If the swollen area becomes red, hot, and painful, it may be an infection. Severe stomach pain together with leg swelling also needs medical attention. Schedule a doctor's visit soon if swelling hasn't improved after trying these home methods for 2 weeks. Also, contact your doctor if the swelling keeps getting worse, if you begin having shortness of breath while lying down, or if your shoes suddenly stop fitting when they used to fit normally. Now let's go through a practical action plan. Week 1. Elevate your legs 3 times daily for 15 to 30 minutes each session. Start wearing compression stockings rated at 15 to 20 millimeters during the daytime. Begin walking for 10 to 15 minutes every day. While sitting, do ankle circles and stretches every hour. Week 2. Continue everything from week 1. Add Epsom salt foot soaks or baths 2 to 3 times weekly. Begin cutting back on sodium by reading food labels and avoiding processed foods. If possible, use a foot massager for 10 to 15 minutes per day, weeks 3 and 4. Continue all previous habits. Increase walking time to 20 to 30 minutes daily if comfortable. Check your footwear carefully. Make sure your shoes fit correctly and provide solid support. If swelling still hasn't improved much, think about visiting a podiatrist. Here's my challenge for you. Use at least 5 of these 10 methods for the next 30 days. Pay attention to your progress. See whether swelling improves. Notice whether your energy levels change. See if walking becomes easier and more comfortable. Then return to this video and share your results in the comments. Which methods help the most? Your experience may help another person dealing with the same problem. If this information was useful to you, leave a comment and tell me which of these 10 methods you want to try first. Share this video with someone struggling with swollen feet or ankles. Subscribe to the channel for more practical health information created for adults over 60. I'm here to help you better manage your health with research-based advice. Thanks for watching. Take care of your circulation, and I'll see you in the next video.